Are cell phones safe, yes or no? The American Academy of Pediatrics in 2016 recommended children should not use cell phones at all.
5G, even though it's a new technology, it's expanding on the technology we have.
Yeah. The craziest part is that how can you have conclusive evidence when last year they stopped the funding for the research? How are you going to conclude it? Hey guys, welcome to the Bodywell Podcast. Today we have a really good episode. My name is Liel. Today with me we have Dror Levy, CEO and Head of Research at Bodywell. And today we're going to talk about probably the most interesting subject is all about the industry that has to do with cell phones and the radiation, and really uncovering the truth about everything you need to know to keep yourself safe and your family safe and what you can do about it. Today I want to talk about really the problem with the industry, and a lot of people are really clueless about this subject, and there's a reason why people don't know about it. So I want to discuss that now, and why there's so much debate on is it healthy, is it not healthy when we talk about cell phone radiation.
Okay, so we mentioned before that that we really want to concentrate if cell phone use is safe, right?
The cell phone itself.
Cell phone itself, right?
No, now mentioning ionizing, non-ionizing, this frequency, that frequency. No.
Exactly. And I think the answer is yes, very clear, right? The debate is sometimes if it can cause this kind of cancer or this kind of cancer. And they use this, the industry, we're talking about one of the strongest industry. They're controlling the news, they're controlling academia, they're controlling almost everything. And we're going to try just to pinpoint on some points, and I'm encourage any listener or viewers that go do a little bit of that deep investigation. You're going to get the picture very, very quickly.
Yeah, I think it's important to mention that this is not a conspiracy, right? We have all the facts right here in front of us. We can provide also all the links for people to go and take a look themselves to see that what we're talking about is not, made up. Everything has evidence behind
it. And again, we're talking about a very strong industry that doing a lot to do that influence. They are extremely active, and again, I think OpenSecrets.org, they can see how much lobbying they do. And again, I think on average it was 115 million every year, and I think this last year, if I'm not mistaken, it's over 200. But let me first kind of lay it down, to see where it is and how the industry were very, very protective when there is some information that they didn't like. And actually, I have in front of me that we're probably going to link into it, an articles that in the PubMed, and then this is actually a very, very revealing documents that actually start the whole story. Well, the whole story starts with, I think in 2011, when the World Health Organization, with no the International Agency for Cancer Research, did those specialists did the research, and they find out, and they want to categorize it, the cell phone, right, the electromagnetic wave as carcinogen, right? And obviously the industry didn't like it. And I want to show you over here it's actually called World Health Organization Radiofrequency Radiation and Health, a hard nut to crack. And this is actually done by was wrote by the IARC, the International Agency of Research of Cancer. And in a way, they part of the World Health Organization, right? They're the experts on cancer that's supposed to advise them. And they did the work, and they find out that they didn't really took their advice. So it was strange. I mean, they're actually the experts, so they didn't understand that. So obviously, because they interact and they're part of the World Health Organization, they did it in a very soft way. But I want to just go to one. It's very interesting to read everything about this. It's fascinating. But I want just to highlight just one part, and that one part says something crazy. And just listen. It says it says, the WHO fact sheets, right? And it says the fact sheets from WHO issue in June 2011. So when the World Health Organization, basically to the whole world, right? This is everybody then quoting them, right? Shortly after the IARC cancer classification, so after they did the research and they publish it and they categorize it, they release a statement which was in May 2011. It says, to date, no adverse health effects have been established as being caused by mobile phone use. Okay, so this is actually a statement that they release, and look what the IARC actually say on that statement. So they says, this statement was not based on scientific evidence at the time, on that time. So the IARC very mildly saying that they did a statement which not based on scientific evidence. But what they actually says, they actually contradict the scientifically evidence. They cannot say it, obviously from the reason because they work for them, but this is clearly black on white when they say the World Health Organization, when they have in front of them the research provided by the body that they hire to do the work, actually did a statement which is totally opposite from that conclusion.
So wait, so who hired who? And we know the World Health Organization, and they're part of the IRAC.
So the World Health Organization, obviously, it's a very big body, right?
Okay.
But they have the International Agency for Research on Cancer. So that's their specialty. Those people working for the World Health Organization, obviously scientists from all over the world, and they do their job on cancer, right?
Okay.
So they actually says that their boss politically decide to make a statement which is not based on scientific evidence. It's crazy.
Yeah.
This is black and white. Everybody can see it. So this is now show the pattern of an industry that when they do studies, only if it's going to their side in a way, and I will show in a second how they actually manipulate the study themselves. But when they're doing it, they publish it only if it's in their favor.
Best interest, yeah.
If it's not in their favor, they are extremely, extremely, extremely aggressive. And the good example of that is actually Dr. Frank. He passed away, but he was in charge on the reflex study in Europe. So they and listen to that. This is actually, there is video with this. He's actually also, I think, has a lecture in Harvard University. But he actually was hired. This is how the industry works. He was hired. He's one of the top researcher, and he was hired in the European Union to do a study. Now, listen to the crazy part. Dr. Frank he says, I thought there is no problem, right? So they hire him because he says, in my opinion, there is no problem. So they say, okay, let's establish it scientifically so we can put it in rest.
Yeah.
We hire you to do that. And he says when he started to do the study, he found the opposite. he was actually shocked, right? He found the opposite. And then when he shared it with those people that hire him, that before that, when they get the funds, they say he's the best, he's the most knowledgeable, he's the one that whatever, right? And then they actually, really, when he wants to, they say to him, you cannot publish it. And he says, this is against my integrity as a researcher. You know what I mean? You hire me to do a research, I need to publish my result. And they actually really attack him to the point that they actually says that this is fraud, right? They actually took him to court, and he won a few times. And they continue, and he says, they destroyed my career. They say that I'm not any more good, and so this is pretty
because he just didn't say what they wanted him to
exactly.
say. And you know what I find the craziest is that, if you do like a simple person solution, right? Most of us are not, very intelligent scientists, but if you just look on Google, it'll tell you right there is no conclusive evidence. But the craziest part is that how can you have conclusive evidence when last year they stopped the funding for the research? How are you going to conclude it?
Exactly. So this is actually making no sense for the normal person, because you say, okay, if the World Health Organization, right, in 2011, not a year ago, not 2 years ago, found out that there is a problem. So you the normal course is that they do another research that either debunk it or says what was not good about this research, why is not correct, why is not applied to us or whatever, or they say, okay, we find out, now we need to change some things or whatever. But ignoring the fact that show that they trying to hide something.
Yeah.
And
sure.
actually, there is a big article. I think this is like 300 articles, so I'm sure not everybody going to read it. But this is actually from Harvard University.
From the ethics department.
Ethics department by Norm Alistair, right? And he actually says how the Federal Communication
captured agency
commission is dominated by the industry. How actually they have a very sophisticated way that they control the agency. Give you just one example, a pretty crazy one. If you go today even to the CTIA, right, which is this is the communication association.
Okay.
Like those big, huge people need association, and you check on the person that in the head of that department, right? In that the CEO, and it's a lady that if you check what she did before, she was actually working for Verizon. I think Verizon, or one of the telecommunication company, as a lobbyist. And if you check what she did before, she was a commission with the FCC. So this is just telling you, this is all same people that kind of, we call it revolving doors, that control it, and they have a goal. They have
an
agenda. And I'm gonna put again, without going too much to the details, because it's really about a certain level of engineering and stuff like that to understand how they can manipulate the information, and they doing it even though we have the documents, because obviously those people, similar to what's happened with the tobacco industry, eventually they're afraid that something in the future gonna so in a way they're showing it but hiding it, you know what I mean? So but somebody like doing a little bit of that investigative and going a little bit and understanding and actually reading whatever can see the full picture.
It's good you brought up the example with the tobacco industry, because there's actually a big difference with the tobacco industry. People started using it in the early 1900s. They started smoking. Then only a few years later, if I'm not mistaken, it was around like 10 years later, there were already signs that there's damage being done. And you know how long it took them until it was actually banned and they actually came to conclusive evidence that it causes cancer? It was only about 50 years later.
Yes.
Okay, now let's just imagine the public is unknowingly using these substances, whether it's a substance, whether it's a technology. They're using it and they think, okay, these people are looking out for me. They care about my health. And they would never let me use something that's dangerous, even if there was a small chance. And with the cell phones, it's even worse in the tobacco industry, because people had common sense not to give kids, 5-year-olds cigarettes. But that's not true about these things. Today, from day one, when kids are already 1 year old, they're using these for hours a day.
They're exposed to it regardless, right? So
and we know that their brain is the skull is much thinner. They have more liquid in their brain. We know the radiation affects the liquid. We know there's more penetration in a child's head. We've seen there's research behind that as well. And there's specific apps and there's specific things that are made for children to use these devices, where we already have the signs. We have the signs. We have the evidence that it's harmful. Yes, it's not conclusive. We know it's hard to make it conclusive because of the industry.
I want to elaborate on that conclusive. So this is just first, I want you to show you facts so you understand the agenda. There is actually was a court case which is from 2020, and that court case was against the FCC, and it was very simple. They actually asked them, since 1996, you didn't find a reason to update
the
safety standards, right? And everybody know that, let's say, even if the technology didn't update it or whatever, just because in 1996, the heavy user was 30 minutes, today, every average kid is 4 and 6 hours, right? So just by that, something have to be there, right?
Updated, yeah.
And again, people the normal people that Google whatever says, oh no, it says everything whatever, and they never try to really kind of dip into it. And so we have a court case, and there is an order. It's already decided, and the judgment was that the FCC have to explain. They don't need to do anything. They don't need to do study. They just need to explain what the reason they didn't update. Now, you would think that this is a regulatory body, right? Somebody that actually that's their job, taking care of our health. They have already the answer, right?
Yeah.
Why they didn't do it? Because, I don't know, they find out that it doesn't matter. But no, they actually, until today, 2025, almost 5 years later, they ignore the court order. They didn't say yes, no, why, tomorrow. Ignore it totally. And this is really the body that's responsible for our health, responsible for our kids.
Mm-hmm.
That's make no sense, right? Forget about the detail and the information. This is just show you how they operate. And they designed to give a liability protection to the industry.
And it's not just about like, okay, we're asking them to ban phones or something, right? It's not that serious. Even the city of Berkeley, they just wanted to have a campaign called The Right to Know. So people will at least, how with cigarettes nowadays, they have a big, they made the boxes very ugly so that at least people will know, okay, you're about to kill yourself, then you should know that. The city of Berkeley tried to do that, to give people, signs outside of the cell phone stores, like, listen, kids are more at risk, listen, there's these risks, just so you know when you use it. And they stopped them from doing that. Why?
Yes.
Why not let people just know that there's a risk and then let them make an informed decision?
They actually was very aggressive about that. They just didn't just stop them.
They shut them down.
Even though they won few times, Berkeley, the city, they appeal and appeal and appeal. I think maybe 5 or 6 times. They just want to exhaust their resources. That is just not going to be.
Unfortunately, they're just far more powerful, so you can't fight them.
I want just to touch a point. So explaining people when you see studies that actually says, like you mentioned before, not conclusive. Even though for the normal person, if one study says or 2 studies says that you can get cancer, but one of them not, I would still need to take the precautionary act, right? But let's try to understand what's conclusive and what level it's actually going to be conclusive, right? And the one thing we find out, there is a very big research done actually in Greek, which really fascinating to read, but is very, very technical. So we're not going to get to the technical parts. But I want to highlight and explain you guys, when they say it's not conclusive, why it's not conclusive, okay? So I will start with it actually says the review of the studies, because these studies actually review all the studies at that point, right? So review of the studies involving exposure to complex RF EMF with ELF pulsion modulations, in other words, what we call mobile technology, the one that transmits information. It's revealed that 93% of them reported induction of OS and ROS, which is oxidative stress and reactive
oxygen species,
overproductions in biological system. In other words, we have a study that actually says 93, I don't know what's more conclusive than that, right? 93% will all actually have that reaction, the biological effect, right? But now, if we're going to go a little bit deep how they did the study or what they found, it's pretty fascinating. But what they say, it's like that. It says like that. It's very important. It says, it's important to note that the exposure level in the vast majority of all the aforementioned study, right? So they actually says the majority of the studies that they find out were significantly below the official accepted exposure limit. So in other words, now this study says, not like everybody telling you, these studies that show result because it was higher level, it's more than what's the safety limit. No, this is actually says all of them actually was significantly below, not just a little bit below, significantly below of the. But now we're touching of, I always trying to get the credit that I'm very, genius and I can find those things. But I really think I'm not that. It just, some people actually know exactly what I know, but really just hiding it. So listen to that. So here it says that at the same time, okay, now they're talking about those studies. At the same time, several other studies have reported no effect, right? So this is the non-conclusive, right? So they say what they did, they went to all the studies that show no effect, right? And listen what they find out. And it says like that, black on white. Where all of the aforementioned studies, basically, especially studies that employed simulated mobile technology. In other words, they're talking about the modulation that we talk about, right? A generation with invertible parameter. In other words, if everybody can read it, it actually says that all the study that show no effect didn't really use a real mobile technology. What they did, they use a generator of EMF, but without the modulation.
Yeah.
And we know the modulations, the transmission of the information is actually what's making harm.
What's caused the biological effects.
Yeah, they actually says that even when they did just with the generation, so in other words, even without the modulation, they still have 70%. But they say when they're using mobile technology, then 95% of the study actually that employed the modulation show the effects. So again, think about it that if the industry actually do their own study, and this is becoming to very dedicated engineering elements that not everybody can understand, not a lot can really even ask about it, but they have a way to manipulate not just the data, because they do it in some other study, but manipulate really the study to show whatever they want to show. And this is important, again, by what I showed before, that they have an agenda. They're just using science sometimes just to disguise the real result, unfortunately.
And we can go like on and on. I have this study right in front of me, which was actually an update from the cancer epidemiology following the 2011 IARC evaluation of radio frequency electromagnetic fields. What they did was they combined multiple studies and they tried to come to some conclusion. And what they found is alarming, especially for parents. I think it's really important that everyone knows, not to scare, but just to be informed. What they found is this. Analysis of the Hardell group results revealed that first use before the age of 20 is associated with the highest risk of glioma and acoustic neuroma. These are brain tumors. And unfortunately, the kids are the most at risk, the most vulnerable. It doesn't make sense to me that parents don't know this. Doesn't make sense. Everyone that has a child should know these things, not to be scared, not to buy our product. To know what they should do and to take the precaution that's necessary. It's ridiculous that really these things, most people have no clue about them.
Yeah, and in continuations to the 2011 that we mentioned before, the NTP, which is the National Toxicology Program, was then assigned to do a study.
$30 million.
Yeah, it's the most comprehensive. Again, in the same time that they spend $30 million, the industry spend $1 billion to. But they are scientists, and eventually the fact is the facts. And actually, the facts was clear evidence, and people were telling you, well, they did it on rats and mice, right? And this is one of the most ridiculous. If somebody telling me, especially if he's an educator, I know that he's part of the agenda.
It's not on humans, it's on mice.
No, the reason is, okay, so why they did it on mice? What, they want to sell cell phone to mice or to rats? What's the reason why they did it? And they don't tell you that 1996 study actually done on mice, but over there they use it.
Yeah, there it counts. Yeah.
But the crazy part, and I want you to know, because this is actually very current. This has really happened in the last year. And then in that study, they actually says that there is, what they say, that says many factor influence whether the damaged DNA will lead to tumors, right? NTP plan to conduct additional study. Obviously, they say, well, we need to investigate, especially when this was in second and third generation. They want there is fourth and fifth, and so forth. But apparently, when you're looking on that paper that they find out, so that part actually says that they need to conduct more studies. And then if you're going to the end of it, it actually says that taking those factors into consideration, no further work with the RFR exposure system will be conducted. So that's kind of very because they actually develop a whole thing, how to measure it and doing it. And now they've been notifying they're not going to do it. Contradict their own things that they need to do it. And that's actually puzzle a lot of people, which actually says what's really happened. And all these things actually talk about it. And they say why the NHI, which is National Health Body, abruptly halt research on the harm of cell phone radiations. So in other words, somebody pulled the funding from the continuation of the research because they didn't like where it showed.
It's going.
And this is actually from 2024, and I think even even 2025, still they're trying to convince the Trump administration to revive this program and at least to let the public know. So this is actually very sad that the groups that are actually in charge on our health, that most of the people trust them to give them at least the accurate information. They really betrayed our trust. They work for different agenda. And unfortunately, don't share with us the real information or the real knowledge they actually have in their position.
Yeah, and I was gonna say, there's the whole deal about 5G. 5G is relatively new technology, and as far as my concern, or as far as what I've seen so far, there's been no safety testing specifically on 5G, which is an entirely new technology using different types of waves and stuff like that. That's already alarming. Consider that the safety limits have not been updated since 1996. It can't be like that. It's by chance. It has to be on purpose.
Yes.
Why?
I mean, I have to tell you that I have some debate with people that I know they're educated, and they told me, well, that study, for example, we talk about it, even the carcinogens that was in 2011 and the NTP that was in 2018 and 19, they said, well, this was on second and third generation. Now we're in fifth generation or whatever. And I want people to realize what they actually says, because people don't know what's really the meaning of 1G, 5G, whatever. And I want to just to clarify it. Guys, you need to understand 5G, even though it's a new technology, it's expanding on the technology we have.
Yeah.
It's not replacing. So in other words, when they're telling you to use 5G, this is just expanding on frequency, but it's definitely contain the first generation. First generation, by the way, is a call, it's a voice, and then second generation is text, and third generation is internet, and fourth generation is like GPS. So each one of those is expanding. It's
adding on to it.
It's adding. So it's cannot be safer. It's if anything, it's actually more dangerous.
Yeah. I mean, we can go on, but for me, this episode is really about bringing this information to the public. Another really interesting one, the American Academy of Pediatrics in 2016 recommended children should not use cell phones at all. American Academy of Pediatrics. This is insane, and nobody knows about this.
The study, think about it, that there is in November, I think 2022 was the last one, but there is appeal. You probably heard about it. They're trying to kind of holding it. And that appeal was of 250, and the numbers growing. I think
today is
267, yeah. So every day there is more scientists, specified, expert in that field, which in charge of almost 2,000 peer review studies, all of them raising that concern. They have a plea. They're actually asking, please just address those issues. We have all the science work, and it sounds that it's falling on deaf ears. And the industry actually much stronger than the voice they raise, unfortunately.
Yeah. And just to clear things up, everything we've spoken until now is basically talking about the worst case scenario, which is brain cancer, God forbid, leukemia, all that scary stuff. But there's other effects, biological effects that because they're not the worst case scenario, they're just completely being ignored. What about children's brain development? What about people's sleep issues that's so important for our health?
Memory.
What about memory? What about all of these other things that are biological effects there are studies that prove it, that it can happen because of the cell phone radiation, and nobody's talking about because, there's barely any attention on the cancer, but this is getting zero attention at all.
I mean, and it's important to know, we're talking about pathologies, and they develop, let's say, on 10-year span, 15-year spans. What do you think happened that it's happened in one day? It's mean that you're already choosing a path of losing your well-being. Every day you are less well because you're on that path. Who wants to be in that path? So you're right. We don't need to consider just on that specific cancer or that, on death. We care about our well-being.
Yeah.
We want to use those devices to enhance our livelihood. So we benefit out of the technology, and not in the other hands hurting ourselves.
Yeah, I mean, hopefully people are starting to wake up. I know other countries have much different rules than we have here in America. Just in 2023 we saw France, they banned the iPhone 12 because its limits were passing what they consider safe, which is nowhere near what the United States is, right?
Yeah. It's actually, I saw a research is actually done, I think, in the UK, but it's actually show and it's scaling like what's allowed in states and what's the protection. And let's say they putting, for example, Switzerland, again, not that safe, but at least they put like a contest in order to understand. So they say, imagine that 30 miles per hour is a safe speed limit, like in urban neighborhood, right? So if 30 mile it's safe, I think they're putting Switzerland, let's say, an 80, right? 80 mile per hour. But where United States, actually the FCC is at? 3,000 mile per hour. So this is just comparison.
It's crazy.
It's pretty crazy. They're putting certain safety limits in a way that it's give a totally freedom to the industry to do whatever, and
it's not really safety limits. It's just to cover themselves.
Exactly, it just calls safety limit, but really allowed you to do almost everything you want.
Yeah, this is like what happens with like anybody who says something about this problem. So the companies say, oh, it just falls within the safety limits.
Yeah.
But
I have another very, and then this is again show you how the industry in general work, or what we consider to be the common knowledge. But I did like a kind of a debate with AI, right? So, and I use it, and I asked the AI regarding
even the AI is corrupted.
Yeah, so I asked the AI regarding the CTIA, right? And the CTIA, again, this is the commissions for all the telecommunication. And I asked the AI, please go over their website and please tell me if you find anything regarding the safety concerns around the EMF, right? And, surprisingly, they actually says yes. And it told me the CTIA actually emphasize safety. And I says, I asked them, I go over, I
Where'd
didn't
you find that?
Can you tell me the source? And then obviously there is no source for that. So it says, it's actually, and it actually show me some kind of safety articles, right? But I went to that article, and the safety they talk about is that the fast communication that provided by 5G allowed ambulances and safety. I ask you specifically about the concern that people have with the ALF. And it's actually played with me a few times, didn't give me the information. And then I says, how come I ask you on this specific website? It says, well, this is common knowledge that they emphasize. And you know what? In the end, the AI actually admit, and it actually says, you're right. According to the facts, it's make no sense that the agency that have all the telecommunication, that telling us how important is 5G and good, don't even address the concern, regardless if it's real, it's not real.
Yeah.
If it's not real, just put something. We hold the position that it's safe or whatever, but they totally ignore it, and so definitely they don't address the concern there is in the industry or in the customers, and it show you what they think about our safety. It's just not there.
It's crazy. Like the agency doesn't have a health department. And then you have all of these top, epidemiologists, people that study cancer, people that study all these biologists, whatever you want. Everyone's telling them, listen, it's not safe, and nothing's being done.
Yeah, it's unfortunate and it's you can see if somebody follow, and if I follow the information, how this guy and move it around and stuff like that. And but one of the reasons why we do what we do is to raise awareness. People can have the information is there, the knowledge is there. Sometimes even if you don't understand the details, but common sense, eventually make it that you understand what it is.
Yeah.
So really our goal is that people just need to be more aware.
Yeah.
And then when you educate it a little bit, you do the right decision for you and your loved ones.
Exactly. If you don't have the information, you can't make a decision. So
Yes.
that's our mission here at Bodywell, is to really bring this to the public. Hopefully this video won't get taken down. So watch it while you can. For those of you who want to, protect yourself right now, you can do simple things like keeping the phone just further away from your body, turning it off, whatever. But for those that want a more convenient solution, we obviously have our products at Bodywell, which are the only and the most scientifically proven ones on the market. You can see everything on our website. I think that's it.
Thank you.
Thank you guys for watching. Please do your homework, be informed. We'll try attaching as many links as possible below this video in the description so you guys can educate yourself even further. Additionally, we update our website with all this information so you can go and check it out. And if you guys have any questions, feel free to reach out to us and we can explain a little bit more.